Hey everyone, Dr. Mike here. Today we're diving deep into a topic that's often whispered about but rarely discussed: openly sexually transmitted diseases. We're talking about the obscure, the unusual, the ones you probably didn't even know existed. We're counting down 20 of these hidden STDs, and some of these are pretty serious. But don't freak out, knowledge is power. And by understanding the risks and symptoms, you can take control of your sexual health. So buckle up, hit that subscribe button, and let's get right into it. Kicking off our list at number 20 is Lymphogranuloma Venereum, or LGV for short. This one is caused by a particular strain of chlamydia, but it targets your lymph nodes. We're talking about painful swelling, and if left untreated, it can lead to long-term damage. Symptoms can include painful sores, flu-like symptoms, and swollen lymph nodes, especially in the groin area. LGV can sometimes be silent, meaning you might not even know you have it. With the right antibiotics, LGV can be treated effectively, but you've got to catch it early. Coming in at number 19 is Donovanosis, also known as granuloma inguinale. This bacterial infection likes to set up shop in warmer climates but can pop up anywhere. Donovanosis causes painful ulcers, appearing on the genitals and sometimes spreading to other parts of the body. The good news is Donovanosis is treatable with antibiotics. The earlier you catch it, the better. If you notice any unusual sores or ulcers, especially after being intimate with a new partner, get checked out by a healthcare professional. At number 18 we've got molluscum contagiosum, a viral infection that shows up as tiny little bumps. They're usually painless but highly contagious, especially through sexual contact. These bumps might seem harmless, but they can hang around for months if not treated. Molluscum contagiosum is usually harmless and often clears up on its own. If you're concerned, your doctor can offer treatment options to speed up the healing process. Chapter 4: Chancroid. Coming in at number 17 is chancroid, a bacterial infection causing painful sores on the genitals. These ulcers can be large, deep, and even bleed or ooze. Chancroid can easily be mistaken for other STDs like syphilis or herpes. Getting tested is crucial. If you notice any unusual sores or ulcers, see a doctor. With the right antibiotics, chancroid can be treated effectively. Chapter 5: Trichomoniasis. At number 16 we've got Trichomoniasis, or Trich. This parasitic infection often flies under the radar because many people don't experience any symptoms. For those who do, Trichomoniasis can cause itching, burning, and discomfort in the genital area. Trichomoniasis is treatable with antibiotics. Regular testing is important, even if you're not experiencing symptoms. Talk to your doctor about getting tested for STDs, including trichomoniasis. Chapter 6: Mycoplasma genitalium. Coming in at number 15 is Mycoplasma genitalium, or MG. This bacterial infection is often silent but can lead to serious complications if left untreated. MG is linked to urethritis in men and cervicitis in women. MG can be resistant to certain antibiotics, making treatment challenging. There are still effective treatment options available. The key is to catch it early, which means getting tested regularly. Chapter 7. At number 14 we've got Zika virus, which can also be sexually transmitted. Zika infection during pregnancy can have devastating consequences for the developing fetus, including microcephaly. Preventing Zika involves protecting yourself from mosquito bites and practicing safe sex. If you're pregnant or planning to become pregnant, talk to your doctor about Zika. Chapter 8. Coming in at number 13 is syphilitic gumma, a rare complication of late-stage syphilis. Syphilitic gummas are soft, tumor-like growths that can pop up anywhere in the body. Syphilis is still out there, and if left untreated, it can have serious, long-term consequences. Syphilis is easily treatable with antibiotics, especially in its early stages. Get tested regularly for syphilis and other STDs. Chapter 9. At number 12 we've got Shigella, which can also be sexually transmitted. Shigella causes severe diarrhea, stomach cramps, fever, and sometimes blood in your stool. Shigella infections usually clear up on their own within a week. Practice good hygiene, like washing your hands thoroughly after using the bathroom. Coming in at number 11 is hepatitis D, which can only infect people already infected with hepatitis B. Hepatitis D can cause serious liver damage, leading to complications like cirrhosis and liver cancer. It can be spread through sexual contact. The best way to protect yourself from hepatitis D is to get vaccinated against hepatitis B. The hepatitis B vaccine also protects against hepatitis D. At number 10, we've got HTLV1, short for human T lymphotropic virus. This virus can take years, even decades, for symptoms to develop after infection. HTLV1 can lead to certain types of leukemia and other neurological disorders. There's no cure and no vaccine for HTLV1. Prevention is key. Practice safe sex to reduce your risk of infection. Coming in at number 9 is scabies, a skin infestation caused by tiny mites. Scabies can be spread through close personal contact, including sexual contact. Scabies causes intense itching, usually worse at night. Scabies is treatable with a special cream or lotion that kills the mites. Treat everyone who's been in close contact with the infected person. At number 8, we've got pubic lice, also known as crabs. These tiny insects make themselves at home in your pubic hair and cause intense itching. Pubic lice are treatable with over-the-counter medications. Follow the instructions carefully and treat everyone who's been in close contact with the infected person. Coming in at number 7 is Mycoplasma uriolyticum, a bacteria often found in the urinary and genital tracts. It can cause urethritis in men and cervicitis in women. Mycoplasma uriolyticum infections are treatable with antibiotics. Get tested if you're experiencing symptoms or if you're concerned about your risk. At number 6, we've got bacterial vaginosis, or BV. BV happens when there's an imbalance of bacteria in the vagina. BV can cause unusual vaginal discharge, itching, burning, and a fishy odor. BV is treatable with antibiotics. See a doctor to get an accurate diagnosis and the right treatment. Coming in at number 5 is Epstein-Barr Virus, or EBV. EBV can be spread through sexual contact and stays in your body for life. Most of the time it chills out in the background but can reactivate and cause problems. There's no cure for EBV, but there are ways to manage the symptoms. Rest fluids and over-the-counter pain relievers can help. At number 4, we've got cytomegalovirus, or CMV. CMV is a common virus that usually doesn't cause any problems in healthy people. For those with weakened immune systems, CMV can be serious. CMV can be spread through bodily fluids, including saliva, blood, urine, and semen. If you're concerned about CMV, talk to your doctor. Coming in at number 3 is herpes zoster, better known as shingles. Shingles is caused by the same virus that causes chickenpox. Once you've had chickenpox, the virus stays dormant in your body and can reactivate later in life as shingles. Shingles usually causes a painful rash and blisters, often on one side of the body. There's a vaccine that can help prevent shingles. If you do develop shingles, there are medications that can help manage the symptoms. At number 2, we're venturing into the animal kingdom with zoonotic STIs like brucellosis. Zoonotic diseases are infections that can spread from animals to humans. Brucellosis can be sexually transmitted in rare cases. Zoonotic STIs are relatively uncommon. Be aware of the risks, especially if you work with animals or travel to areas where these infections are more common. And finally, at number 1, we have hepatitis G, HGV. The jury's still out on whether HGV is definitively sexually transmitted, but it's one to watch. Practice safe sex, avoid sharing needles, and be cautious about blood-to-blood contact. So there you have it, folks. 20 hidden STDs you probably never knew existed. Remember, knowledge is power. The more you know about STDs, the better equipped you are to protect yourself and your partners. Getting tested regularly is crucial, even if you feel fine. Early detection is key when it comes to treating STDs effectively. Stay informed, stay safe, and keep those conversations going. Until next time, stay healthy.